we go back to that statistic about the returns that you get from just being 3 stars in this measure alone, start thinking about the downstream effects of having somebody in the home, right? There's, of course, the other gaps that you can close while you're there. Maybe it's a A1C test or bone density screening, something to that effect. But you've also taken an action to build trust with the member, both from the health plan standpoint, as well as the person that's actually interacting with the member. And so that can just carry on. That has a trailing effect on how the member engages with their care. Because the ROI on that can be so big, that drives the visit into the home and really takes the cost factor out of closing these other gaps, if you will. And it's not just the one polychronic member in one home. We've been to the Virgin Islands. So that was taking a whole group that is typically underserved by most standards. We got a team together, did some cultural assessments and training for them to go down there. And then we saw several hundred people in the span of 3 to 4 days, close several hundred gaps that would not have been closed had this action not been taken by the health plan. And you had this group of people that was open to it, that wanted the care. A lot of times they would have to travel back to the States to get it. You're not only closing the gaps, you're creating a great member experience for these people that are in a typically underserved population.